I'm Michael Grossbard. I'm a medical oncologist at NYU Langone Medical Center and Perlmutter Cancer Center. I treat hematologic malignancies prominently, so those would be leukemias, lymphomas, myelomas. My particular expertise is in the area of non-Hodgkin's lymphoma and Hodgkin's disease, and I treat largely adult patients, so patients over the age of 18. Cancer has become much more complex in managing over the 2.5 decades that I've been doing this. When I started out as an oncologist, it was fairly easy to keep up on the advances in each of the different types of diseases. The scientific advances and clinical advances have come so fast and so far that in order to just keep up on the best care for your patients, to understand how to best treat a particular tumor, you need to be specializing in that tumor, you need to be involved at an institution that's intimately involved in the science of those cancers, that's intimately involved in developing the new therapies. But the biggest transition over the past decade has been to move away from chemotherapy for everybody and move toward more targeted therapies. We're doing a lot more therapies that target specific pathways that have gone bad in the normal cell that turn these cells into cancer cells. And by blocking those pathways, we can get really nice responses in patients' tumors. And in addition to that, we can do it without requiring intravenous chemotherapy and without all the side effects of chemotherapy, without the hair loss and the nausea and the vomiting. I work very closely with a whole support team. My nurse practitioner is involved with every patient and sits in on the initial visit of every patient and then spends additional time with the patient afterwards to provide counseling about the diagnosis, to provide counseling about any chemotherapy or biological therapy that we might administer, to go through a whole set of supportive issues. All of these people are remarkably patient-friendly, and the patient experience is one that is extremely personalized. Each patient comes in and is treated as an individual and gets to know everybody and really becomes part of the Perlmutter Cancer Center family.